Hello, and welcome to another Facebook Live broadcast with MedStar Health. My name is Sarah Ridenauer, and today I am joined by surgical oncologist Dr. Edward McCarron. In support of Skin Cancer Awareness Month, we are discussing this most common form of cancer, its risk factors, prevention, and importance of early detection. So stick around, give us a like to let us know you're watching, and be sure to share this broadcast with your friends. Before we dive into our questions, Dr. McCarron, thank you again for being here. Would you tell our viewers a little bit about your background and what brought you to MedStar Health?
Oh, sure. So, Sarah, obviously I'm a surgical oncologist, and I returned to Baltimore and MedStar Health because this is actually where I grew up. I trained with a melanoma specialist here in Baltimore, Dr. George Ilias, and then I went up to Roswell Park to do my cancer training in Buffalo, New York, and then came back to join the surgical oncologist here. So it was a perfect timing and a perfect situation for me to come back so I could pursue the care of patients here in Baltimore.
That's awesome. Well, like I said, thank you for joining us today and taking time out of your day to be here and answer some of our questions. So the first question is, let's just start off with, what exactly is skin cancer?
Wow, okay, that's a very broad question. And I think if I was going to have to answer that, it's kind of a question of like, what is cancer in general? And I think about normal cells in the body kind of have a certain program where they kind of form tissues, form organs, support the body, and then they kind of die off. They serve their purpose and then die off. That die-off has a very scientific term called apoptosis, which is programmed cell death. So cancer cells kind of change their genetic ability so that they can avoid programmed cell death, so that they can live and divide aggressively forever. So any cancer cell in the body, prostate, breast, colon, skin, any of those cancer cells kind of learn how to avoid that programmed death and then grow out of control. Not only can they grow out of control, they also learn to live other places so they can spread throughout your body. So if you have a skin cancer, those cancers can sometimes get into your lymph system or your blood system and spread to other places. So cancer is a concept that obviously doesn't only deal with the skin, but cancer cells kind of grow and develop almost from several different organs.
Well, thank you for that. You just gave us a whole science lesson right there. So are there some different types of skin cancer?
Oh, yeah, there definitely is. You have the most common types of skin cancers are called basal cell carcinoma and squamous cell carcinoma. And those skin cancers we refer to as non-melanomatous skin cancers. And they're kind of like a nuisance. I would imagine anyone in the audience listening has probably had a friend or family member or even themselves that have dealt with squamous cell carcinomas and basal cell carcinomas. Now, the one that kind of becomes more worrisome is melanoma. And so then you have your melanomatous skin cancers. And the melanomas are so problematic because at certain stages, they can really become aggressive and spread outside of the skin. And that's the greatest worry with melanoma. That's why, again, I kind of consider the basal cell and squamous cell carcinoma a nuisance. People have to get them treated. They have to get them removed. The melanomas become more of like, how much risk have I incurred by this diagnosis? Is this a threat to my life? And those are kind of the problems that occur with melanoma.
Okay, so yeah, you kind of, already answered my next question, which are some of the types of skin cancer worse than others? It sounds like, melanoma's a really dangerous one.
Right, right. And I don't want to overstate it because, there might be many people listening who have a diagnosis of melanoma. I mean, when we think about it, I mean, melanoma is very common. And I would say about 1 in 65 to 1 in 70 Americans will deal with melanoma at some point in their lifetime. But the beauty is that the majority of those can be cured by surgery alone. So it's really a smaller group of patients that incur all that risk of, routine long-term follow-up, scans, imaging, additional treatment. That's a small select group of people, but the majority of patients can be cured by surgery alone once they've been diagnosed with a melanoma.
Okay. And so what are some of the risk factors for skin cancer? Like what are some of the possible um, causes of it?
Well, I would say kind of number 1, 2, and 3 is excessive sun exposure.
Mhm.
And the way we like to think about it is exposure to ultraviolet radiation or UV rays, right? So everybody knows the sun is ultraviolet rays. And the problem is that energy coming into your body can cause changes in the DNA of the cells. And it's kind of these DNA changes that can take that normal cell and transform it into a cancer cell. So, so the greatest risk factor is definitely excessive sun exposure. Um, then, of course, the other big problem, which I think is hopefully becoming less of a problem, is tanning beds.
Mm.
So we would prefer that people just avoid the tanning bed. You are not protecting yourself by getting a base tan at the beginning of the summer. And I think most people have come to understand that. And I would even have the kids avoid the tanning beds before proms, before weddings. That became very popular. And
Mhm.
unfortunately, it did increase people's risk to skin cancer over the general population. And I can tell you what I've seen now the younger folks doing is spray tans.
I was,
So it's okay to do a spray tan. I mean,
yep,
that's great,
yeah,
Um, and then obviously your other risk factors would just be your skin type. I mean, everybody knows who gets the bad sunburn at the beach, right? The lighter skin, lighter hair, if you want to take it to the extreme, red hair, green eyes, freckles, those are the folks that have trouble, at the beach in the sun. And then obviously, if you have a strong family history, you'll want to be aware of how much sun exposure you're getting.
right. Yeah, like I said, I was gonna mention spray tans. I love a good spray tan. So stay clear of the tanning beds, get a spray tan.
Exactly,
Um,
exactly.
so what are some skin cancer?
Okay, well, I think people have to just become comfortable doing a skin check and kind of looking in the mirror and paying attention to other folks. So we always push. I mean, it's been said over and over and over again, and I hope this public service message is really out there. Everyone's heard of the ABCs of melanoma, right?
Mhm.
So if you have a mole and it's changing in any way, you would probably want to have a skin biopsy done. So obviously, if I ran through all the letters of A, B, C, D, E, asymmetry. So if one side doesn't look like the other side. Um, B is border. So if it develops an irregular border. C is color. If it develops irregular color. So a part of the mole is dark black, another part of the mole is brown. Um, the D is diameter. So everyone says if it's bigger than the size of a pencil eraser, you should probably get it checked out.
Mhm.
The E is for evolving. So has it changed? It looked one way one year and then the other way the next. And I can tell you, it's interesting how my office always seems to get a little bit busier around this time of year because I think more people are in bathing suits, they're out swimming. I think the family member or the friend says, "Hey, what's that on your back?" Or
Yeah.
and then I always love it when um, people go for their haircut or hairdresser and the hairdressers pick them up.
Mm.
So that's great. Like if the barber says, wow, you have a mole on your scalp, you better get that checked out. So those folks you talk about saving lives, they've definitely saved a few lives by encouraging people to get skin biopsies.
Yeah. Yeah, that's interesting you bring that up because I know I have a lot of moles just, on my body. And so I'm always looking at the bigger ones, trying to check and see if they've changed a little bit or just, ones that are darker than the others, look at those. But I never even thought about ones on my scalp. But your
Hmm.
scalp gets sunburned, your scalp is exposed to sun too and all that. So
And
that's
and I think, yeah, and I think I'd like to kind of, say like the evolving issue as well. Because not all melanomas are going to be pigmented or dark.
Mhm.
Um, very few melanomas can be what we refer to as amelanotic, where they almost look like a wart. They don't look like a jet black mole.
Right.
So just be aware of that. So if you have something on your extremity that just kind of keeps getting bigger or forms an ulcer, I mean, don't just say, oh, that must be a little wart or something, and then ignore it. So I just wanted to make sure people weren't just totally focused on the dark black skin lesions.
Yeah. It's always better to be safe than sorry.
Absolutely.
Yeah. So what can people do to prevent skin cancer? What are, some sun safety tips, obviously sunscreen and all that, but any other tips you have?
It's interesting. The guidelines for screening in melanoma, what is it? The United States Preventive Service Task Force came out with some guidelines, and I read through those, and it's complete common sense.
Mm.
It's like it's not some big defined like one you do this, two you do this. I mean, they kind of wrote the guidelines like that, but in the end, it basically is avoid excessive sun exposure.
Yeah.
That's all of them. And it's such a difficult thing because to try and prove that in trials and studies becomes very difficult because of the numbers of patients that you would need, the statistics you would have to analyze. That becomes a difficult thing to like prove by the numbers. But I think it's just a common sense issue where if you're at the beach, you don't want to be on the beach between the task force says 10 and 4.
Mhm.
But I don't know. I guess I have to be reasonable with folks, and I try and say 10 and 2,
Yeah.
10 to 2. And then if you're out there, don't be afraid to sit under the umbrella.
Right.
I mean, folks, I know it's carrying one more thing down to the beach, but man, I would just do it.
Yeah.
So,
Plus you get hot. It's nice to sit in the
yeah,
shade for a little bit. I love umbrellas at the
exactly.
beach. Taking
Exactly.
a little nap under there.
Yep.
Um, so I'm going to take a moment to pause and just say, if you're just now joining us, thank you for tuning in. Today we are joined by a surgical oncologist, Dr. Edward McCarron. And since May is Skin Cancer Awareness Month, we're discussing this most common form of cancer, along with its risk factors, prevention, and the importance of early detection. We have a lot more to talk about, so stick around, share this video with your friends, give us a like to let us know you're watching. And of course, if you have any questions for Dr. McCarron, you can ask them in the comments below and we will get to those. So continuing on, why is it important to detect skin cancer early?
Oh, wow. Yeah. So early detection is so important because if the skin cancer is diagnosed at an early stage, the treatment can be very easy. Um, the only thing that would be required for an early stage melanoma is a simple wide local excision where we just take a small rim of normal skin around the melanoma and the patients are done. So, but if you look at a mole this year, you put it off, you don't get help, a year goes by, then another year goes by, and then you show up with what we refer to as intermediate thickness melanoma. You think of them as thin, intermediate, thick. If you show up with an intermediate thickness melanoma, wow, then you're getting scans, you're having lymph node biopsies, you're being considered for additional treatment. So, and also the risk from the melanoma just goes up, up, up. So as far as it spreading to other organs. So please, if you notice something changing, don't hesitate with it. Don't delay. Because again, things are so much more treatable. I won't even say treatable. I'll even go out on a limb and say curable if they can be identified very early.
Yeah. Yeah, and you kind of touched on this a little bit too with that question. But can you talk a little bit more about what steps you can take to detect it early?
I think, again, it's just being vigilant and also kind of understanding things. So um, the the most common diagnosis of melanoma, like the most common age, occurs in the sixth decade of life. So it's our 60-year-olds that are going to be diagnosed with melanoma. So if
Okay.
you think about any malignancy or cancer, we like people to be checked 10 years prior
Mhm.
to the cancer diagnosis. So if the majority of patients are getting diagnosed at 60, man, maybe it'd be nice if they had a good skin exam at 50.
Right.
And so, if you're kind of one of those people that worked construction, worked crabbing, worked on a boat, worked outside your whole life, or just enjoyed boating or enjoyed swimming, maybe you should go see a dermatologist at the age of 50. And it's not necessarily specific to dermatologists either. A good family physician can do a good skin exam and identify these moles. I've had many patients referred to me from primary care physicians as well.
Yeah.
So I guess to answer the question, it's just to be aware of your body and make sure that you look.
Yeah.
And also the biggest thing is not to ignore a problem.
Right. Yeah, yeah, that's definitely important not to ignore a problem. And you talked about primary care doctors. I feel like that's a good starting place for a lot of issues. If you have,
Absolutely.
questions about anything, primary care doctor is always a good place to start, and then they can direct you to the right people to get the
Right.
help you need. So, uh, talking about screenings and all that, can you talk about the screening guidelines? You talked about age, is there a specific age that you should just go get checked up? And you also talked about professions, if you're out in the sun more. Can you talk about, the guidelines and recommendations for when and who should get screenings?
Right, right. So again, like as far as the guidelines go, it's not like mammogram guidelines or colonoscopy guidelines. So it's not like at age 40 you do this, at age 50 you do this. Like I said, the guidelines were so vague. Um, so I think number one, according to the guidelines, it would be to avoid excessive sun exposure. And
Mhm.
then if I was in a high risk group, I would definitely go early for a skin exam. So like, I mean, here I am, I'm kind of almost going to be 50. So it's probably time for me to go get checked out,
Mhm.
which I already have been, obviously. But
Yep.
so, yeah, I have a good relationship with my dermatologist. So, yeah, definitely at age 50. But, they'll say even starting at the age of 24, according to the guidelines, they'll say age 24 to 60, have good skin examinations and those things. But I'm not sure how practical that is, but if patients kind of do self-exams and they have follow-up with their primary care physician, and then those at higher risk see a dermatologist, that would be smart. Now, it's interesting because when I see my patients in follow-up who have been diagnosed with melanoma, I'll say, "Oh, do you have children? Oh, are they still at home? Oh, you should get them checked." So I think if you had a first degree relative with melanoma, meaning mom, dad, brother, sister, or child,
Mhm.
you should definitely have a full skin exam by a dermatologist. And I always say you should be a little embarrassed after your skin exam. I mean, they need to look everywhere.
Yeah. So, okay, so we're going to talk about treatments next. But first, I wanted to bring up a comment that we got from Dr. Kumar. And they say Dr. McCarron is the best, great surgeon and colleague. Um, and we also have a question from Sunny, and they ask, how common is melanoma of the foot?
Oh, wow. So, okay. So melanomas can occur in areas that are not sun exposed. And I know that kind of leads to some confusion. So we refer to those as acrolentiginous melanomas, and they do occur like on the soles of people's feet. And, that can typically occur in people of color. So you wouldn't think of African American patients getting melanoma, but definitely on the palms of their hands and soles of their feet, they can develop melanomas. Um, so it would be a rare occurrence. Probably like when we think of these atypical melanomas, probably less than 10% of the whole volume of melanomas. But again, it definitely people need to be aware of that. So if you are a person of color and you have a dark spot on the palms of your hands or soles of your feet, I mean, again, be aware that a biopsy would be appropriate.
Yeah, that's good. Thank you for your question. So getting into treatment, first of all, just basic, how is it treated? What steps would you take when a patient comes in, and you know, what would you recommend for treatment? Does it kind of differ depending on the situation, or?
It can. So if my focus is mainly melanoma, the dermatologists offer a lot of treatments for the other skin cancers, the basal cells and the squamous cells. Um, as far as the dermatologists go, they're using a lot of something called Mohs surgery, which is a way for them to remove the non-melanomatous skin cancers without making large cosmetic defects for patients, or, so if you have something on your central face or hands, feet, I mean, sometimes those techniques are much better, but my practice primarily focuses on melanoma care. And so surgery is the best treatment for melanoma. And what does that consist of? So like I said before, if you show up with an early stage melanoma, you would just need like a margin of normal skin excised around the biopsy site or the mole, and that is all that's required. If you jump up into the intermediate thickness melanomas, like melanomas that are maybe greater than 1 millimeter in depth, um, they require a lymph node biopsy. And so we refer to that as sentinel lymph node biopsy. So that lymph node, the sentinel is the guard, right? The guard at the gate. So if the melanoma was trying to leave the skin and go to the lymph node or the lymph system, that guard lymph node will grab it and hold on to it. And so that's how we determine the risk associated with the melanomas. So if that sentinel node is positive, then patients may be considered for additional treatments, typically by Dr. Kumar, the treatments that would treat melanoma throughout your whole body.
Okay. Um, and so you also, once again, kind of touched on this, but my next question was, are some treatments better than others?
Oh, well, definitely. I mean, you always want to be a surgical candidate, right? Because you always want to be what we refer to as, you always want to be rendered free of disease, right?
Right.
So free of microscopic disease. So if I'm able to go in and remove all of the cancer, that puts you in the best situation to survive without the melanoma coming back. Now, if patients are in a situation that is a bit higher risk and that melanoma has spread, um, there are several treatments available to them that are provided by our medical oncologists. So I'm a surgical oncologist that does the surgery part of it. Then you have the medical oncologist that does I won't even call it chemotherapy, because chemotherapy is not commonly used in melanoma. I guess I should refer to it as systemic therapy. It treats, again, throughout the whole body. And we focus our systemic treatments on immunotherapy. So people have seen those commercials on TV. I mean, it's very popular. The lung cancer commercials are touting pembrolizumab and ipilimumab and all those mAbs, right? So all those mAbs are basically like immunotherapy that allows your immune system to target the cancer cells and kill them. So I would say that immunotherapy is the most effective systemic treatment once the risk of the cancer has kind of gotten beyond what surgery can do.
Okay. And now, are there any new treatments available, or hopefully will be available soon?
So we do a lot of melanoma research here in our clinical trials, and we're very fortunate to be affiliated with the Georgetown Cancer Institute. That allows us to participate in a lot of clinical trials. And what that does for the patients in the audience is that will allow someone access to a drug that may not be available to them outside of the trial. So the current trial that I'm accruing most of my patients to right now, I don't want to be too technical about it, but if you're a stage 2B or 2C melanoma patient, you would not be eligible to receive immunotherapy. But the current trial that we're conducting allows that category of patient to receive immunotherapy. And what they're finding is that they can reduce the risk associated with higher level intermediate thickness melanoma so that those patients can have better outcomes. Now, believe me, the people that participate in those trials are very brave, because if it's in a trial, it is a question. And we don't always, we think we know what the answer is going to be, but you don't always know what the answer is going to be. So we need people to be willing to participate in those trials so that we can continue to advance the care of our patients. You know, it's almost like who would have been the person that took the first COVID-19 vaccine,
Yeah.
right? So
Yeah.
those drugs would have never been approved if somebody didn't step up and say, hey, I'll take it.
Yeah.
And so that's kind of how medicine evolves and how we get better at what we do. And, you know, I mean, I guess it takes a lot of brave patients to, participate in those things.
Yeah. Yeah. Like you said, that's the only way things are going to get approved and get better and advance. And so shout out to all those patients that were brave enough to
Absolutely.
participate and
Yeah.
take it for the team.
And then one other, I might as well get even more technical, right?
Yeah.
So when I talk about those genetic changes in the cells that make cancer cells, so there's something called a tyrosine kinase pathway, where there's a bunch of signals that come through the cell to tell it to divide, right? So when I'm teaching my residents and fellows and everything, it's like the pathway is like RAS, RAF, MEK, ERK, right? So we have BRAF inhibitors, right? So that's the RAF. And we have MEK inhibitors, so that's the MEK. So if one of those pathways is turned on, the cell will keep dividing like out of control. But we now have drugs that will go right to that switch and turn it off.
Oh, wow.
And so those are that's the other type of treatment that we do called targeted therapy. So you have immunotherapy and then targeted therapy.
Mhm.
And so believe me, we use both of those in combination when we're treating our very high risk patients. Now, this is not the run of the mill stage 1 melanoma that comes through the office. These are the higher risk patients.
Okay. Can you talk a little bit about the difference between the different stages of it?
Oh, sure. So the way we think about risk in melanoma is how deeply it grows into the skin. So it's as simple as our dermatologist looking under a microscope and literally measuring how deep it grows into the skin. So obviously, the deeper it grows into the skin, the more access it has to a lymph channel, to a blood vessel, to hop in that little channel and then spread,
Mhm.
right? So if you think about stage 1 patients, I mean, their overall survival is going to be like 98% or
Yeah.
something, right? That survival will drop where if you're a stage 3, like a later stage 3 patient, I mean, that 5-year survival rate can be like 60%. So 6 out of 10 patients would be alive at 5 years. It's interesting because the latest data on stage 4 patients, I have not even seen that produced. Historically, I don't want to be negative,
Mhm.
but historically, we would say that someone with metastatic melanoma would not survive beyond a year.
Wow.
But with the recent developments of immunotherapy and targeted therapy, they have not even figured out what that time frame is because
Yeah.
patients are living well beyond a year. I
Yeah.
mean, if you get responses to those treatments, I mean, you can even achieve long-term survival. So the stage 4 numbers aren't even available right now because they're getting better.
Yeah. Well, that's awesome to hear. But yeah, that's another reason why, it's important to detect it earlier, and so you can get those treatments started as soon as you can, and hopefully it doesn't, have the time to develop into something worse than it started out.
Exactly. Yep.
Yeah. So with that, I'm going to ask you the last question, a little wrap up. What is the message you want our viewers to take away? I think I know what you're going to say, but I'll let you go ahead and say it.
Yeah, and I hope you were thinking avoid excessive sun exposure. Yeah,
Great
so
hands.
that's it. So get through the summer without a blistering sunburn, and
Yep.
do not let your kids use a tanning bed.
Yes.
So and then also please please keep an eye out for your family members at the beach, and if you see something on somebody, let them know. I mean, if I see something on you at the beach, I'm going to let you know you need a biopsy. So but great. Well, listen, Sarah, thank you so much, and I love the opportunity reaching out to the local community, and I hope someone heard the message and gets treated early if they need something.
Yeah, of course. Well, we really appreciate you being here. And like I said, that wraps up our broadcast. Thank you to all our viewers for watching and tuning in, sharing your questions, giving us likes. If you want more information or to schedule an appointment, you can visit the link in the description. And we'll also be posting a link to our recent blog post that we did with Dr. McCarron on melanoma and other skin cancers in the comments below. If you'd like to give that, check that out. So thank you again, everyone, for joining and for being here, Dr. McCarron, and answering some really important questions. And we will see you all next time.
Sounds great. Thank you.
Bye.
Bye.